And let's stay in Poland because joining us now is Dr. Michał Maciejacek, family medicine specialist at the Polish Mothers Hospital right there. Good morning to you, Doc. Nice to see you again this morning.
Good morning. Good morning. Nice to see you as well.
The situation seems to have fallen off the radar in terms of refugees and people requiring treatment and the kind of medical challenges that are being faced by people moving from Ukraine to other parts of the world, particularly Poland. Now, in the case of Poland, you and I have discussed this several times over the last couple of months of this conflict. If you take, for example, the situation with COVID-19, many Ukrainians were not vaccinated before the war started. And of course, vaccination became impossible after that. So they're moving with potential to other countries that were already battling that problem. Could you tell us today what is the situation on the ground in Poland as you know it?
The situation is that typically every year between June and August, we see that the amount of patients in primary care is much lower than other parts of the year. And this year it's even bigger than it was in April or May. So basically we are facing a lot of extra patients, not only with COVID, but with different infections. And that's also the time of holidays in Poland. So the amount of doctors is a bit lower and we start to struggle with helping everybody. And the problem with COVID is starting to grow up. We see the amount of positive tests growing. And our government decided by the end of May that they will stop massive testing. I think it was a mistake, but now we don't have a proper data to really focus on. But on the amount of people that I see in my practice, definitely that problem is growing and growing quite fast. The good news is that that particular variant of COVID is less problematic. It's a infection that lasts 7 to 10 days and in most cases doesn't need hospitalization on serious treatment. But that can change in any moment. And if you look on the statistics of Germany or England, they have hundreds of thousands new cases a day. So that's what's coming. And even the best prognosis says that by the end of summer, we will have another wave.
You are a family medicine specialist, so I mean, you get to see children, you get to see their mothers, and of course you get to see their fathers. Now, apart from worldwide pandemics such as COVID, what else are you getting to see apart from the common things that afflict people who are living in very inclement conditions, possibly in camps and all of that? They don't have the right clothing and or the right even diet and all that. Do you, for example, because the thing that is happening in Europe, in parts of Europe, is monkeypox. I haven't heard any reports of that, of course, in Poland, but you could update us if it's different. That's on one hand, but what are the other ailments you're getting to see?
About the monkeypox, the situation is that we had, I think, 3 cases that were confirmed in Poland, but it's not spreading too much, and that's really just a few checks and 3 positive cases. So that doesn't be a problem, at least soon. But we definitely see much more cases of diarrhea and problems with digestive system. And it's not only because of the conditions, because most of those people are actually lives at homes with Polish families. The camps are that's a very limited number of people that lives there. But you said yourself that the diet is another problem. It's a bit different diet than they are having at their homes. And the second to all of that is that we've been apart from each other for best part of last 2 years. Now the situation is then when we are meeting together, we have a similar situation as children in primary schools in the beginning, that they interchange their diseases and getting sick a bit more often. That's what's happening here, and it's not only respiratory system diseases but also diarrhea, that kind of problems. But it's nothing too massive, but it's starting to put a lot of pressure on especially on primary care.
That was going to be my next question, because at the base of all of this is access to healthcare and how overwhelmed or not practitioners like yourselves are. I know that when we spoke for the first and second times, you were seeing quite a lot of people because there was a very large influx at that time, and you were saying that the facilities may not be able to cope. Is that still the situation? And are you as a person who owns a practice, or as a country, which is Poland, getting the much promised help that you and I talked about a few months ago?
We are on a big pressure. At that point, we are coping with it. So it's not the situation without any, but if we will get even a bit more patients, and it's coming because of the next wave in autumn, we will have a problem. The good thing is that the Polish government actually dissolved the problem of prescriptions and access for the Ukrainians to Polish healthcare system. That's the good part. The bad part is that the amount of doctors is still the same as it was. And as I told earlier, we are in a basically starting, but for next 2 months we have a holiday season, so a lot of people are getting their time off, so the amount of doctors is a bit smaller, and that's the problem. Now, if we didn't get too much help from outside, that's for sure, and I don't see it coming basically. At that point, I think that it will still take months or even years to dissolve the problem in Ukraine, and a better part of the refugees that are in Poland, even if they would like to go back to Ukraine, even if you would stop the war today, they don't have anything to go back to. Some of the cities are completely ruined, and there is a different story if you are just an adult that needs to rebuild your home. But if you have 2 or 3 kids, there is no way to live during winter in Ukraine without any supplies, without heating, without energy. So there is a huge problem, and it's a problem for years, not days, not weeks, but years. In my opinion, rebuilding of Ukraine will take a lot of time, a lot of effort, and a lot of money. And we need to prepare for that because there is no other way to do it.
Thank you so very much, Mikhail Macierewicz, family medicine specialist at the Polish Mothers Hospital. Stay safe, my friend.
Thank you very much. All the best, and hope to talk to you soon.
The French government is preparing for a total cutoff of Russian gas supplies, which it sees as the most likely scenario.